Hello everyone, this is Dr. Sultan Minuddin Shaukat. I welcome you all to IkraMed Academy. Once again, greetings from IkraMed, and we are in this sessions on splenic ultrasound. In our previous session, we have seen the fundamentals of splenic ultrasound. The probe which we use is the convex probe. We had seen where the spleen is located, the important splenic pathologies. Okay, and we also saw how a normal spleen on ultrasound appears. Okay, now in this lecture we are going to see further, and this small lecture is based on indications where you would specifically look for spleen. Number one. Number two, I would talk about what are the various known splenic pathologies which can be diagnosed on ultrasound. Okay, so this would be based on this concept. So let us begin with this. So now when it comes to ultrasound of spleen, we have got a list of benign disorders, there is a list of intermediate mass lesions, or there is a list of malignant mass lesions, and there is a list of diffuse infiltrative process and multifocal splenic lesions. But let me simplify so that the things become easier for you and you remember when to look for spleen. Okay, chalo, I'll give you an illustrated image so that things will become always permanent in your mind and you won't forget them. So now let's look at what are the important things which should be looked for in various category of patients. So number one, when do we look specifically for spleen? In suppose patient comes to you from medicine department, okay, or a physician sends you a patient. Now let me draw spleen for you first so that we can start. So suppose the spleen is there, okay, spleen is somewhere here. Now suppose the patient is sent from medicine department, then what are the things which you need to keep it in your brain? Look if the patient has jaundice. Jaundice, splenomegaly. The next important thing you have to rule out is hemolytic anemia. Very important. What is the another finding which we see in patients with splenomegaly and hemolytic anemia? Another important finding is there in gallbladder, where you see multiple calculi. So GB-cal is a very important sign of hemolytic anemias. Okay, chalo, this thing is clear to all of you. The first important indication, of course, is case of hemolytic anemia. Sometimes you might find that the spleen is enlarged, and again, let us assume that this is a patient which is sent by physician and he has got some medical illness, and you see that there are multiple calcific foci. How do I identify calcification on ultrasound? It would show the calcification and there might be some shadowing, okay, the posterior acoustic shadowing. So enlarged spleen, calcification, and suppose associated with that you find that IVC is dilated, patient has got pedal edema, this means this is congestive splenomegaly, or we call it as CPVC spleen. This is specifically seen in case of heart failure. And what are these calcified bodies? These are called Gamma-Gandy bodies. Okay, so sometimes you might find this Gamma-Gandy bodies inside the spleen. Clear all of you? So hemolytic anemia is congestive splenomegaly. Suppose patient doesn't have this, patient doesn't have edema, patient doesn't have jaundice, but suppose patient is alcoholic. If the patient is alcoholic, in this case, you might see that there are changes of cirrhosis in the liver. So liver is shrunken, liver shows surface nodularities like this. So this will be signs of cirrhosis. So signs of liver cirrhosis is liver showing surface nodularity, liver size is shrunken, and you see at the same time spleen is enlarged. What does this mean? That this you should look for the splenic vein which would be dilated more than 10 mm, and you should look at portal vein which is dilated more than 12 mm. So now this is a case of portal hypertension. So also in case of cirrhosis and portal hypertension, you will find that patient has got splenomegaly. Clear all of you? Another medical cause where you can get splenomegaly are, suppose patient doesn't have cirrhosis, patient is non-alcoholic. Any other liver disease which leads to cirrhosis can also cause portal hypertension and splenomegaly. Okay. Now, suppose patient has fever, chronic fever, and he has got splenomegaly, then infective causes, typhoid, dengue, malaria, massive splenomegaly, kala azar. If the spleen is too huge, you can't even measure, think of kala azar. Another important cause where you can get splenomegaly, especially the patients who are being referred from physicians, is with patients of CML. What is CML? Chronic myeloid leukemia. So if patient has got CML, you'll find that there is massive splenomegaly. Okay, you can't even measure the spleen. Okay, so CML, and there is one more condition which is called EHPVO. That is a surgical condition where you get EHPVO, extrahepatic portovenous obstruction. This is one more condition where you get massive splenomegaly. Okay, Kala azar, CML, EHPVO. Now, so hope this part becomes clear to you. Now, we'll also talk about some important splenic lesions, that is benign splenic lesions. So, what are those? Splenic cyst, pseudocyst, especially the pancreatic pseudocyst might extend into the spleen, forming a splenic pseudocyst. Splenic lesions may hemangioma is the commonest benign lesion, and we have seen in liver how does the hemangioma appear. It appears bright on ultrasound. Similarly, splenic hemangioma also appears bright on ultrasound. Why is it important to identify it? So that you don't biopsy it, or else it will lead to torrential bleed, patient might die. And next important is splenic lymphangioma, hamartoma, splenic calcified granulomas can be seen. Then there are angiomatoid nodular transformation, variants of hamartoma, extramedullary hematopoiesis we have seen right from beginning, especially in case of thalassemia. We have extramedullary hematopoiesis and severe massive splenomegaly, splenic abscess, especially in immunocompromised patient, HIV patients, you can have multiple splenic abscesses. Okay, especially in HIV patients. Splenic hydrated cyst is again one of the common entity. Inflammatory pseudotumors, lipoma, angiomyolipoma, fibroma, sarcoid, focal splenic lesion. Especially in Gaucher's disease, you have got special hyperechoic areas in the spleen. So if this is spleen, you will find that there are multiple hyperechoic areas, or sometimes they are heterogeneous. These are called Gaucheromas. One important thing which I have not mentioned here is tuberculosis. In case of TB also, you will see that inside the spleen you see multiple hypoechoic areas in TB. This represents splenic tuberculous granuloma. The splenic granulomas. So these are important pathologies which you should know when it comes to spleen. Now other important, so out of all of this, the most important things about spleen is when the patient comes from surgery side, one and foremost thing when patient comes from surgery side where you should look for spleen is when the patient is sent for esophageal bleed. So suppose patient is a case of esophageal varices. Varices means dilated vein, and patient is having lots of bleeding in vomitus, blood in vomitus. Okay, so that is hematemesis. So patient is having blood in vomitus. So now in this case again, if a patient is sent, the next important thing you will look for is look for spleen and signs of portal hypertension. So what are signs of portal hypertension? Patient with splenomegaly, splenic vein dilated more than 10 mm, portal vein dilated more than 12 mm. You might see associated liver cirrhosis. You might see associated ascites. So all are important findings when it comes to patient with uh, hematemesis, which who is referred from surgery. Other important thing for surgery patients, usually suppose there is tuberculosis, you might find tubercular granuloma, sometimes calcified granulomas may be seen. So next important differential you get is granulomas. Another important pathology in spleen which is very important is, especially in HIV positive patient, we have seen is splenic abscesses. Now, another very important differential for splenomegaly is lymphoma. Lymphoma and splenic lesions, especially like hemangioma and lymphangioma, etc. Okay, metastasis. Most common splenic lesion which is seen is METS, usually after hemangioma. It is metastasis. Okay, spleen is known to show metastasis from other organs. Okay. Okay. Now with this, let us look at the other important indications where we look for spleen. And what are the other splenic lesions? Intermediate mass lesions like solitary fibrous tumor or littoral cell angioma or inflammatory myofibroblastic tumor of the spleen. Malignant lesions of the spleen like splenic lymphoma, angiosarcoma of the spleen and splenic METs. Okay. And we have malignant fibrous histiocytoma. Diffuse infiltrative process. So here you find that the entire spleen is enlarged. You will find that the entire spleen is enlarged, large in size. Especially if it's a child, refer from pediatric population, always remember glycogen storage disorder. So just telling them that there is splenomegaly is not sufficient. You should try to look for the underlying cause. So in case of glycogen storage disorder, especially Gaucher's disease, you might find there are Gaucheromas. Okay, Gaucheromas. Especially in those patients like Tay-Sachs disease, you might find signs of portal hypertension along with splenomegaly. Okay. Now in case of EHPVO, that is extrahepatic portovenous obstruction, you find there is massive splenomegaly and you might find that there are small pseudoaneurysms within the spleen. Okay, this can be seen on ultrasound. Okay. Now in cases of pancreatitis, sometimes you might find that the splenic artery may undergo pseudoaneurysms, which can be seen in case of pancreatitis. Okay, so pseudoaneurysms in case of pancreatitis. Yeah. So these are all important other things which you need to look for spleen. Massive infiltrative splenic disorders. So in which we have got tuberculosis, histoplasmosis, splenic hemosiderosis, amyloidosis, multifocal splenic lesion like lymphoma, METS, sarcoid, fungal abscess, granulomatous infection and Gamma Gandhi bodies. So these are all what how an approach to the spleen should be, what lesions can be localized on spleen. So this was a brief overview of what all are the things which can be looked on spleen. Now other important things includes, especially if the patient is referred from surgery. So very important. So suppose there is a patient who comes with a rib fracture or patients with trauma. So in these patients, always try to look for spleen, the perisplenic fluid. Next important thing is look for perisplenic fluid. Okay, so perisplenic fluid denotes hemoperitoneum. Okay, especially in patients of trauma, try to look for splenic lacerations or hematoma in the spleen. Okay, next important thing which often is seen especially in cases with splenic vein thrombosis is infarcts. So you can get splenic infarcts. So now what is important? Normally we see spleen with a deep probe, convex probe, but if you want to look, if there is splenomegaly, patient is complaining of pain in splenomegaly, acute onset pain, then we should suspect that there could be an acute splenic in focal infarcts, and they should be looked with SP probe or superficial linear probe, okay, so that these things become visible. So splenic rupture, traumatic spleens, injury, that is blunt organ trauma. In case of non-traumatic splenic infarct is an important thing, spleniosis and splenic piliosis. So these are all important pathologies which you need to look for. Okay. Now hope the things and indications and what all, how we should approach in a patient of spleen becomes very clear to you. Just to summarize in this slide, you should look at spleen from 4 different angles. 4 different angles, whether the patient belongs to a medicine category, so whether the patient has infective etiology like typhoid or dengue or malaria, this form of splenomegaly, kala azar, or patient is a case of CML, or patient with case of portal hypertension. When patient comes from surgical side, again you have to rule out portal hypertension as an important cause of splenomegaly with collaterals. Okay. Another important thing which you should rule out is splenic trauma in the form of hemoperitoneum or splenic lacerations. If we have a pediatric patient, most important after infections, the another important thing in case of massive splenomegaly which you have to rule out is the storage disorders. Okay, so there are multiple storage disorders in which you get splenomegaly. Okay, yeah, hope this solves up and you have understood that what all do we think of when you have got splenic pathologies. Okay, when it comes to thinking of malignancy, you remember, or lesions in the spleen, the most important lesion of the spleen are hemangiomas and abscesses. Okay, metastasis is more common as compared to primary lesion of the spleen. Most common primary lesion of the spleen is benign lesion is hemangioma, malignant lesion you get lymphomas over there. Okay, so here I stop this session. Now this session was to make a sonographer's brain think in a way a clinician thinks, so that when patients come to us, we are not mere doing tailor work, that is measuring liver, measuring spleen and giving it off, but we think from a physician's or surgeon's point of view, and we try to help the patient out, help the referring doctor out, so that entire diagnosis is well made. Okay, hope you have enjoyed the session. Your feedbacks are most welcome. Okay, now next session would be on practical demonstration of splenic ultrasound and on various pathologies one by one. So I discuss on splenomegaly, and then one by one we'll take different pathologies. Hope you enjoy it, and your feedbacks are most welcome, comments are welcome, doubts are also welcome. I'll be enjoying to solve your doubts and comments, etc. Thank you.